Good afternoon. Thank you for joining us. Well, rural emergency rooms are short-staffed. Take Chetwynd, for example, where the ER has had to close for the 11th time just this year. Have you been affected by an ER closure? And what can BC do to bring more doctors and nurses to rural communities? In half an hour, North Shore Rescue has become busier and busier each year. Have you needed the help of a search and rescue team yourself? What's your advice for staying safe? 2 members of North Shore Rescue will take your calls. I'm Michelle Elliott. Welcome to BC Today. Thanks for joining us on CBC Radio 1, CBC Television, and we're live streaming as well. You can find us on YouTube or use the CBC News app and hit the video tab. You can call us now on our top story. Have you been affected by closures of emergency rooms at hospitals? And what can we do to bring more doctors and nurses to rural communities? You can call us now, 1-800-825-5950, 604-669-3733. You can also hit pound 690 on your cell phone. And you can email us, bctoday@cbc.ca. Well, emergency rooms in BC's rural communities are still being forced to close due to a lack of doctors and nurses. Chetwynd Hospital's ER department was closed on Monday and into this morning, and it's been closed several times since mid-April. Elsewhere in the north, there have been at least 7 interruptions of service at the Prince Rupert Regional Hospital ER. In the interior, the emergency room at Caribou Memorial Hospital once again closed overnight due to a lack of nurses. And in Clearwater, Helmkin Memorial Hospital had to close emergency services for several hours last week. Well, we're asking you, have you been affected by ER closures in your community? And how can BC bring more doctors and nurses to rural areas of the province? You can call us now, 1-800-825-5950, 604-669-3733, and you can hit pound 690 on your cell phone. By email, you can send us your thoughts to bctoday@cbc.ca. Joining me now is Dr. Gord McInnes. He's an emergency doctor and president of the Section of Emergency Medicine with the Doctors of BC. That's the BC section of emergency medicine. He's also involved with Rural Doctors in Aid. Good afternoon, Dr. McInnes. Thanks for joining us.
Good afternoon. Thanks for having me.
Why is this problem still ongoing with ERs?
Well, I think it's not only ongoing, it's been ongoing for some time.
Yes.
And there was, all signals were pointing towards us having this problem in the past. Unfortunately, those signals weren't taken up. And what I mean by that is there's been a number of changes in the way physicians practice, the type of jobs residents are looking for when they're finished and starting practicing. And all of these things kind of contribute to some of the problems we're having, not only in the rural areas you talked about, but also within our urban areas as well.
And how much more acute is it when it comes to rural areas where there are, there's a fewer number of hospitals and people then have to travel much further if they're even able to?
Yeah, absolutely. And I mean, the one that you're speaking of now with regard to Chetwynd, when they do close, patients are expected to drive, I think it's 103 kilometers to their next hospital, which would be Dawson Creek. And as you can imagine, if you're sick and in need of care, that's an awful long way to go.
Yeah.
So, that's not just happening in the Northern Health, but also, as you mentioned, in Interior Health and on the island as well. So again, these are problems that are ongoing that I think we need to start kind of looking, in a sense, that old term of looking outside the box and in ways that we can fix that. But understanding that there's only going to be so much we can do short term, and we really need to set some long-term goals to basically provide the healthcare that I think Canadians and those in BC especially have come to count on.
What are those long-term solutions you think we should be pursuing?
Well, as you know now, SFU, for instance, now has a medical school. So I think that's helpful The government has opened up new nursing spots as well. But again, these are things that we are not going to see for a while. We need to look seriously as well at some of the other programs and some of the ways to offload our patient population that doesn't need emergency services.
Mm.
So, for instance, when there needs to be a system in place. And in fact, funny enough, the section and Ministry of Health and a number of other partners have been looking collaboratively as a way of how we can get patients when a call is placed to 911 to really understand, does that patient need 911 services? Do they need perhaps detox services? Do they need mental health support? Is there somewhere else other than the emergency department that might be more beneficial to the patient and allow our departments to decant a bit to allow us to do the work that we were kind of designed to do?
And I imagine, we've also been hearing about closures of walk-in clinics. And so that then probably diverts more patients to the ER.
Absolutely. And, some communities, walk-in clinics are not an option at all. And then we do have, urgent primary care clinics that have been in place. The number of patients that are seen in urgent primary clinics is quite low during the course of each working day in comparison to true urgent care centers. For instance, the one that I currently am working at now in Parksville, we see about 150 patients a day, which does offload the amount of work that my colleagues at Nanaimo General, because many of the patients are actually coming up from Nanaimo to be seen in urgent care. However, there are no walk-in clinics in Parksville, and we're doing our best to try to attract new family doctors to open up full-term practices
Oh.
as well. And that's in an area that is not like the ones we're talking about when we talk about Chetwynd or Port Hardy or Clearwater. So again, we need to think of ways that we can collaboratively bring more docs into these areas because they're great areas. The community has a lot to offer. And but if you've never been there, if you've never practiced there, it's a big leap of faith to actually take a job, if you will, and jump in with both feet.
It's about recruitment as well. Dr. Gordon McInnes is with me, who works in Parksville at Oceanside Health Center, previously worked at Kelowna General Hospital. He's an emergency doctor and president of the BC section of emergency medicine with Doctors of BC, also involved with Rural Doctors in Aid. So we're talking about emergency rooms having to close due to a lack of staff. Doctors and nurses are needed in those rural communities. So we're asking you, have you been affected by an ER closure yourself? What was the impact on you? And what can BC do to attract and recruit more staff to rural health communities? Our numbers are 1-800-825-5950, 604-669-3733, and you can hit pound 690 on your cell phone. Cal is joining us from Kelowna, from your old stomping grounds, Dr. McInnes. Hi there, Cal.
Hi, how's it going?
I am fine. And you wanted to talk about that recruitment of doctors.
Yeah, I think it's pretty easy. I know in the Interior Health Division here, I think we fired 1,500 unvaccinated doctors and nurses. Bring them back, solves the problem instantaneously.
1,500 in the interior?
That was the number, although it's hard to get any real information unless you do a FOIA request, and I'm not sure they'd even hand that over.
An FY. So tell me a little bit about yourself. Have you been affected by an ER closure?
I haven't personally, but I know people who've been affected with surgeries. I know one of the top anesthesiologists in Vernon. He was fired because he wouldn't go along with the mandates. So I know a cancer doctor. She had to go to Alberta and drop all her patients. How does that feel when the doctor that's been looking after you for months or years is all of a sudden not allowed to, continue with their treatments, and then you have to start again with a new doctor that they bring in who doesn't know your history? That doesn't seem like the best course of action for health outcomes for people in BC.
Cal, thank you very much for the call from Kelowna.
Thank you.
You take care. That's Cal joining us. And what Cal is referring to was that vaccine requirement for healthcare workers. That was an order from the provincial health officer. And that was, in fact, taken to court. And recently, just actually a couple of weeks ago, the BC Supreme Court ruled that the province's COVID-19 vaccine mandate for healthcare workers was justified based on the significant risk posed by the virus during that mandate when it was renewed in October 2023. Now, according to a judgment posted in mid-May, the judgment said that around 1,800 workers lost their jobs for being unvaccinated, contrary to the mandate. Those include nurse practitioners, surgeons, psychiatrists, and administrators. And the workers argued that the province's orders were not reasonable. Let's go back to our guest here. And Dr. McInnes, what are your thoughts? At this point in time, does that mandate still stand? And could that be a solution? Is it too risky, or is it time to allow those workers to come back to hospitals?
It's an excellent question, and I understand where Cal's coming from. The numbers that you talk about, I think we really do need a breakdown of what we're talking. I know of one physician from KGH that has not returned to work. And from a nursing staff, there was 2 or 3 of, again, a group of hundreds from KGH, and all but one have returned to work. So I wonder a little bit, when we add in administrators and others, I wonder what we're really talking about number-wise. On the other side of that, I can't support enough the vaccine program. And although, again, I'm sure Cal means well, but when you've had the opportunity to watch people die in front of you unnecessarily, it's kind of a different point of view. And I think if Cal and I got in the same room and discussed this, I'm not sure we would come to any solution. We would just respect each other's point of view. Mine is that the vaccination program is worthwhile. I've had, I think, 7 vaccines at this point. I have my RSV vaccine. I've had my Prevnar. I've had my shingles shots. So, I'm very comfortable with the vaccination program, as are my adult children and my spouse. And so, again, I don't think that is going to solve the problem that we're talking about, which is having adequate human healthcare resources that have been, slowly decreased in supply over time while we have a building population. I do think the government is responding to this. And as I said before, they're looking at long, medium, and some short-term solutions right now.
Let's take another call here. Ruth is joining us from Salmon Arm. What did you want to say about ER closures, Ruth?
Yes, I'm just wanting to speak to the recruitment issue, and two suggestions I have. One is that medical schools, it's not just enough to open up spaces. I think we need to do like the military does and pay people's way through medical school or through nursing school in exchange for return of service in rural areas. So
like
that
a premium.
would help that. But, like your guest said, it's going to take a while before that has any impact. The other thing that could be done right now is today's generation of doctors do not want to be entrepreneurs anymore. They want to have a salary, they want to have benefits and a pension. And so shift the way we pay doctors. It's not enough to just pay family physicians longitudinal care. I think all doctors who want to be on a salaried system should have that option, and that should be available in all emergency departments. I think you'd have a better time recruiting people.
Yeah. Have you been affected at all by a hospital closure, ER closure?
No, thankfully not. But I am a family physician that's been practicing for 32 years.
Okay.
And I've seen a big shift between when public health care came into being. It was converting doctors who were already private entrepreneurs over to a public system. And now we've had this system for 50 years. The new doctors coming out don't want the hassles of being business people. They want to just have a salary, benefit, some paid holidays, maybe some paid sick time, and know that they have a pension at the end of it all. And so I think our governments need to heed that and start shifting over.
Ruth, really good to hear from you. It's interesting, you've called in before. I did not know that you're a family physician in Salmon Arm.
No, I've never disclosed it until now.
No, you learned something new. Well, good to have you back, and thanks for sharing that with us today.
Okay,
you
bye.
Take care. That's Ruth calling us from Salmon Arm. Now, Dr. McInnes, there has been a new arrangement, right, in terms of the payment system with regard to doctors, because this was something that was coming up quite a bit in terms of doctors saying they're spending too much time doing administrative work.
Absolutely, and I'm glad Ruth called in, but and she mentioned the LFP program, which is a new platform financially for family docs, and it has been instrumental and long overdue. The unfortunate thing is there's always unintended consequences, and one of the unintended consequences is although eventually, the LFP model will incorporate some extras for those that provide emergency services. It doesn't currently, they haven't got there yet, but they will at some point look at that. The unfortunate thing is working Monday to Friday in your office is now, in a sense, a better financial decision and definitely a better stress decision than working after hours, 3 or 4 o'clock in the morning in your local emergency department. So these are some of the unintended consequences that this long overdue model has, I guess, provoked more thought on.
Wow.
That's another.
Pardon me. Let me just, if I could just jump in one moment, just to clarify, LFP is a longitudinal family physician payment model, and this was that alternative to that fee-for-service model that the doctor said that family physicians said were not working for them. So that's interesting, though. If I can note that, are you finding that there are people who have worked at ERs or would have worked in ERs who are going into family practice because they're attracted to that longitudinal family physician payment model?
Absolutely. And I think Ruth hit the nail on the head in the sense. I mean, if you just look at the numbers, for instance, just when that program started in BC with regard to residency spots in family practice, which they often had empty residency spots in family practice, there was one empty residency spot that first year. There's been none this year. And yet, if you compare to Ontario and Quebec, not this year, but the previous year, I don't know the numbers this year, were 110 and 90 empty family practice spots. And that shows you right there that I think Ruth's dead on in the sense that docs are looking for, an easier way to be compensated for all the paperwork they do, the administrative duties, the teaching, and in a kind of a bundled package where they feel that, their time is being valued. And unfortunately, some of our other specialties beyond the specialty of family practice, in a sense, make markedly less than your average family doctor working again in the office. So it's one of those unintended consequences, and it's something that, again, we've been working with government to try to kind of come up with some solutions there too.
Okay, let me just take one last call here. Toby is in Kamloops, and Toby, you worked in hospitals as an occupational therapist.
That's right. Can you hear me?
Yes, we sure can. Go ahead.
I think I do certainly think that doctors and nurses are important in the ER, but I think just one thing I wanted to point out that the listeners might not quite appreciate is that an ER isn't just doctors and nurses. So if you break a bone, it's an X-ray technologist who does the X-ray. Or if you need an ultrasound for a tumor or something, it's an ultrasonographer. If you get your blood taken, it's a phlebotomist. Or if you have trouble breathing, it's a respiratory therapist. So those are just other paraprofessionals and health science professionals that are also part of the ER. And I thought people should know that.
Yeah, absolutely, Toby. Thank you very much for the call. And let me see here. I'm just going to wrap up here. I'm looking at how much time I have left here. Dr. McInnes, just one last word to you. What should we be looking at then in the short term to solve this?
Well, again, I don't think there's a solution in sight, but there's some means to address it. The biggest thing is we do need to work collaboratively with our partners. We need to start thinking outside the box. And that may have there may be different ideas for different communities with regard to what needs to be done. We talked about recruitment and retention of doctors. We didn't talk about the Rural Urgent Doctors in Aid program, which we provide oversight for these rural and remote and often primarily Indigenous areas to provide some sort of care to our nursing colleagues that are really providing excellent care with very limited resources. So there's so many things that I think we could beef up that are already in place. But like again, it's such a complicated issue. There's no one solution. But I am glad we're looking forward to, again, those medium and long range goals to hopefully get back on track.
It does feel a little bit like we're just scratching the surface here, and I hope we get to talk about this again. Thank you for your time.
You're very welcome. Thanks for having me.
Take care. Dr. Gord McGuinness is an emergency doctor and president of the BC section of emergency medicine with Doctors of BC. 12:27 now. This is BC Today. And we have a lot more on the day's top stories coming up throughout the day here on CBC Radio in Metro Vancouver. Here's what's coming up on the Coast.
Hi, Michelle. It's Amy Bell. Just want to give you a look at what we're going to have on the show today. So I'm sitting in for Gloria on the Coast, and we're going to talk with Danny Ramadan. He's going to share his memories of growing up gay in Syria and what it took to write his wonderful new book, Crooked Teeth. He is going to join us, and we've actually got a copy of his book to give away. And we're also going to hear about how the Broadway subway construction is impacting businesses in the area. And we're going to speak with one restaurateur who's actually decided to just close up shop. So we'll have all that plus the latest traffic and weather. It's On the Coast on the air every weekday starting at 3, and I hope you can listen.
Thank you very much, Amy. That's Amy Bell hosting On the Coast this week, and you can listen to her this afternoon on CBC Radio 1. And of course, Jason D'Souza with All Points West and Sarah Penton over in Radio West in the interior. Join us tomorrow on the show. The federal housing minister, Sean Fraser, will join me here in studio. He will be in Vancouver, and so he'll spend some time here in studio taking your calls and your questions and comments with regard to how the federal government is tackling the issue of housing here in BC. Lots to talk about with the federal housing minister. Sean Fraser will be our guest tomorrow. This is BC Today here on CBC. I'm Michelle Elliott. Very nice to be with you this afternoon. And coming up in our next half hour, well, you have heard of them many times. North Shore Rescue getting busier and busier these days. Well, we'll have two members of North Shore Rescue joining us. They are featured in a show on that airs on Knowledge Network. Pretty incredible, the kinds of rescues that they participate in. We'll hear some of their tales, and we want to hear from you as well if you have ever needed the aid of a search and rescue team wherever you are in the province. And let us know what that's been like, what you learned from that experience, and what are the safety tips that you would like to share? What have you learned being in the outdoors in British Columbia? And if you're involved in search and rescue too, I know we have listeners who do participate in volunteer time with search and rescue teams in the province. You can give us a call in our next half hour. We'll be joined by members of North Shore Rescue. That's coming up after this CBC News Update, and here's Robert Zimmerman.
Good afternoon. 2 people are dead after a crash near Chase involving 2 semis. RCMP say one of the trucks flipped just before midnight while making a right turn on Highway 1. The second truck smashed into the flipped vehicle, killing the 2 people inside. The other driver suffered minor injuries. A 31-year-old man from Vancouver Island is facing several child pornography charges after a joint investigation by Canadian and U.S. authorities. RCMP say the suspect was identified in Langford after allegedly luring 3 girls and creating child sexual abuse materials that he posted online. The BC Prosecution Service has now approved 7 charges, including making and possessing child pornography. And Surrey's mayor has blasted the province over delays that meant the new Patella Bridge won't be open to traffic until the fall of 2025. Brenda Locke also says it's remarkably short-sighted to replace an aging 4-lane bridge with a new 4-lane bridge. She says the lack of foresight will worsen congestion and threaten economic growth. And now the forecast on the north coast, a chance of showers this afternoon with a high of 12, highs reaching 16 with a chance of showers as well in the Peace. In the central interior, including Prince George, a high of 10 with showers and a risk of thunderstorms, highs up to 23 with showers in the Kootenays. In the southern interior, including Kelowna, a few showers with a high of 19. And for Metro Vancouver, Greater Victoria, and the Fraser Valley, more rain this afternoon with highs to 14 degrees. That's your CBC News update from Vancouver.
Thank you, Rob. We were talking about alternatives to chicken the other day.
Right.
Because prices are set to go up.
Sure.
I do have a lot of chicken in my life, in my diet. You don't.
A little bit. No, I do eat chicken.
Okay.
Yeah. And fake chicken. I eat fake chicken sometimes.
Yeah, and does it taste the same?
Sure. Yeah. You just put some sauce on it. Yeah.
Tastes like chicken.
Mm-hmm.
We got some emails with some suggestions from people on chicken alternatives, and Donna wrote from Kelowna, and she wanted to suggest butter soy curls. They have a really good texture and easy to cook with. Just reconstitute the dried curls with vegan chicken flavored broth. And then they taste like chicken. And then I also
did not know that.
I did not know this either. She coats them with oil, and then you guessed it, air fries it for a few minutes.
It's a winner.
And then they get all crispy.
Nice.
Yeah, so there's something for you to try in your air fryer.
So tell me again, what is it? It's
butter soy curls.
butter,
So
soy. Okay.
they must be somewhat like tofu. I'm not sure, but
Yeah, I've never seen them.
there you go. So you do have chicken, you do have fish, and
Yes.
butter soy curls now.
Sure. Yeah. That sounds delicious.
It'll taste like chicken, apparently.
Great.
Which is what you wanted. There you go. Something for your air fryer recipe book.
Good tip.
Yeah.
Thank you.
Thanks, Rob.
All right.
Rob Zimmerman in the CBC Vancouver newsroom. Welcome back. You're with BC Today here on CBC. We are live on Radio 1, live on CBC Television, and of course, live streaming. You can find us on YouTube. Just search for CBC Vancouver, and you can catch us, both listen to us or watch us. Just use the CBC News app and click on the video tab. We'll have 2 members of North Shore Rescue joining us in just a couple of moments. Right now, we were taking your calls on hospital ER closures that have still been ongoing in BC, especially in rural parts of the province, on the island, up north, in the interior as well. We're hearing about Chetwynd. And last week, Clearwater, Prince Rupert Regional Hospital has had some ongoing closures. So as this issue continues, we asked you if you've been affected and what can be done to recruit more hospital staff, more doctors, more nurses, and as you heard earlier, paraprofessionals as well, to rural communities. And Robin is joining us from South in Kimberley. Hello, Robin.
Hi, how are you?
I am fine, thanks. And what did you want to say about recruiting more health professionals to rural care?
So I think actually we're missing a whole section, as was mentioned before, with paraprofessionals. So with down in the States, they use a lot more massage therapists and other paraprofessionals in the hospital, which helps. They've done studies where this actually leads to less use of the nurses, which creates less drag on that part of the professionals in the hospital. So I think we need to start looking outside the box that we've been working in so that we can start using the professionals that exist, but we aren't using in the hospitals.
Right. And yourself, is that the category you fall into?
So yes, I'm a registered massage therapist.
Okay.
So we have lots of registered health professionals. So they are trained properly, and we have them in the registered arena. So they are also under the Health Professionals Act. And if we can start bringing them into the public health sector and out of the private sector, then we could start accessing them in that way to help alleviate the crisis that we're in now.
And for a massage therapist, registered, what's in what way could that alleviate the pressure on nurses?
Well, so with pain management and when we get into the what's called the biopsychosocial model, when we start looking at that area and people start to feel more cared for in the hospital setting, then they're pushing their buttons less, right? They're needing to access the nursing care less. And so then the nurses can do the jobs that they need to do more easily, and they have more time to do that. So then the drain on the nurses is less, and therefore less on the doctors in turn. And there have been studies done on it in the United States, and it's shown quite a dramatic drop in the accessing of nursing care on those wards where they're using massage therapists. So I think that if we start looking outside the box, and this is just the arena that I know, but I'm sure there's studies in lots of other registered professionals as well, that if we start looking outside the box, where we could access other professionals to bring in instead of just focusing on a resource that we maybe don't have a lot of right now. And even if we start training more, that's still years down the road before we have access to them.
So certainly what Dr. McGinnis was saying, it's a long-term picture. Really interesting to hear from you. And when you talk about massage therapists in the private system, your point is bringing them into the public system and easing the pressure there. Robin, great to hear from you. Really interesting point. Thank you.
Thanks very much. Have a good day.
You too. That's Robin joining us from Kimberley. 12:38 now in the Pacific time zone. Well, there's hardly a long weekend or a sunny day or fresh snowfall in which members of North Shore Rescue are not busy. Last year was their second busiest ever with 158 calls recorded. Now, they've become so well known that there's now a docu-series about the team. And tonight at 8 o'clock, season 2 of Search and Rescue North Shore begins on the Knowledge Network. Here's a clip.
This is North Shore Rescue. We're inbound to your location.
You're in a tight situation.
And when you put more people into an area, more accidents are going to happen.
The team is always looking at ways to innovate. A hand holding a cell phone.
Stay put!
Our first night hoist. We knew the monumental difference this would make.
Kind of in the tree a little.
The most important commitment is time. Are you willing to leave your family or your loved one for a complete stranger?
As soon as people found out I was pregnant, are you still going to do your rescue work? The answer was obviously yes. The team is a family in itself.
We work closely with Squamish Search and Rescue.
Squamish attracts some of the most extreme athletes.
Anytime you're taking risk, something can happen.
We're going to be joined by 2 members of the team, and we're asking you as well, have you ever needed the help of a search and rescue team? Are you involved with search and rescue in your community? You can share what you have learned about staying safe in BC's outdoors. I'd love to hear from you. 1-800-825-5950. 604-669-3733, and you can hit pound 690 on your phone or email us bctoday@cbc.ca. I'm pleased to welcome my 2 guests. Mike Danks is North Shore Rescue Team Lead, and Bizaj Safari is a new member of the team. Hello, welcome to both of you.
Thanks for having us on the show.
Hello to our audience as well. Thanks for having us.
Yes, thank you for joining us. I know that it is rare to be able to pull you away from your duties and being on call, so I appreciate your time. Mike, we've interviewed you many times on CBC following rescues. You've been with North Shore Rescue for many years. How would you describe your experience with the team when you reflect on it over the years?
Well,
It's really, I've said this a few times in past interviews, and it's really a privilege to be a part of search and rescue in British Columbia. And I mean that because you have the ability to touch so many lives of people that are in need, and that also touches their loved ones as well. So I think we're really fortunate to be able to be a part of the organization. There's a lot of rewards to it, and there's a lot of challenges with it as well, because not every call is a happy ending. But those are the things that we really try to prepare our members for.
Why is it getting so busy?
I think if you look at the increase in population in Vancouver, the tourism that we have, the fact that Vancouver is so close to the three North Shore Mountains, access is really easy there. And being outdoors, being athletic in the outdoors has really gained popularity. And because of that, I think that's why you're seeing the rise in calls for search and rescue in the Lower Mainland.
And Bazad, for you, what brought you to joining North Shore Rescue?
Yeah, thanks for asking. And, it's a great honor to be part of the team. Personally, the reason for me to doing that was a sense of giving back to the community. And I don't want to say it in a cliche way. It's really, and it's great to actually be able to living in this country, especially in this town as well. And, so beside the community service is the personal fulfillment that comes with it as well, helping saving lives and with the people who are in a critical situation, provide a profound sense of accomplishment and purpose. Plus, there is a lot of personal development that is achievable by being part of the team as well. You engage in a lot of team working activity, a lot of leadership activities as well. That usually will not come up on the day-to-day working environment.
We heard earlier the time commitment. I've heard Mike Danks talk about this in the past, but for you, did you find that daunting, or is that something you're willing to commit?
I honestly, before joining, I didn't expect to be, that intense. But as soon as I got into it, I realized how critical the job that the team is do. We are all volunteers. Nobody's obligated to be there. So there's that sense of responsibilities, everybody's carrying it, and you just get to that atmosphere, and you just don't count the hours that you're putting in. But to telling the truth, the first 2-3 years that we're going through that intense training is really demanding. But again, in a good way, in a really adventurous way, especially the fact that you learn a lot of new skills as well.
My two guests, Mike Danks and Behzad Safari, both members of North Shore Rescue. We're taking your calls. Have you ever needed the help of a search and rescue team? What did you learn? And if you were involved in the search and rescue community, you can give us a call too and share your own advice for staying safe in the outdoors. Our numbers are 1-800-825-5950, 604-669-3733. And speaking of people who have been helped by North Shore Rescue, Clark is joining us in Burnaby. Hi there, Clark. Welcome.
Good afternoon, Michelle.
Yes, tell us about your experience.
I feel like I know Mike Danks. I don't think I've ever met him, but I feel like I know him. I've heard him speak so often.
That's true.
When I heard you were dealing with North Shore Rescue today, I thought I had to call in with my hopefully a short story. I was a middle school teacher in one of the local school districts maybe 15 years ago. I won't mention the district to not place any blame, but I had a group of middle school students. We were winter camping up on Mount Seymour, and at the end of April, last weekend of April, and it was raining all weekend in the city, and you probably know what it was doing on the mountain, snowing. We all woke up with a foot of snow, and in my case, on top of my bivy sack, and all the students had snow on top of their tents. And through a sequence of incidents, I decided that it was time to. The girls were getting. They're all female students. I had a female teacher with me, and the girls were getting a bit of hypothermic. They were starting to shiver. Oh. And of course, when teenage girls start shivering, well, the others have to join in for sympathy. So we had several shivering young girls, and I called 911. In those days, cell phone reception was not the greatest on Mount Seymour. I had to climb a small hill to get the call out. I told the 911 dispatcher exactly where we were. Elevation and location on the ground. And but unfortunately, that wasn't passed on to the North Shore Rescue Team. So it took 8 searchers 2 hours to find us.
8 searches?
Yeah, searchers. Yeah,
8 searchers.
To find us.
Wow.
And one of the searchers joked with me that they dragged me out of church to come and rescue you guys. But it wasn't really a rescue. We were needed help to get all these young women and all our gear down to the parking lot, which was only 20 minutes away.
But they were feeling symptoms of hypothermia.
Exactly.
Yeah.
And being a teacher, I was very conscious of them being under their health being my responsibility. So I decided that it was,
sure.
I forget the expression. Something's better than valor.
And Clark, obviously, this experience has stayed with you. What do you think when you look back on it?
I think it's the gratitude that I felt at the time and still feel that they were willing to send out eight searchers, and look all over Mount Seymour to find us, and that these people devote so much of their time. And I have watched the first season of the Knowledge Network series. They're willing to devote so much time away from their families to devote to helping people who are in trouble.
Yeah, Clark, there it is. That's the nub of your story there. Thank you so much for calling in.
Thank you. I'm glad to tell it.
Thanks, Clark.
Do you remember that, Mike? Were you involved in that rescue? Do you remember?
I don't remember that call, but I do remember the quote that he said about someone getting pulled out of church. I know exactly who that was.
That's the thing. You are pulled out of something, right? And what do your families say about just the way that you do get called upon in the middle of various family activities and commitments?
Yeah, I mean, I think the reality is it does have an impact. And I mean, I really started to see that when I stepped into the team leader role, and, I'd be playing with my kids and my phone would ring and you could see the disappointment in their face, and because you're going to be leaving, but it is for a great cause. And I think we've really tried to emphasize to our members that you need to find that balance between work, between your volunteering with North Shore Rescue, and then with your family, because that is what is going to be sustainable for our volunteers moving forward is really finding that balance.
Yeah. And Behzad, for you, do you try to find that balance so that it is sustainable for you?
Yeah, absolutely. And, I was doing a tour in our facility, and for I think they were around like maybe 10 or 11-year-olds kids. And one of them, I showed a picture of the team, and one of them, and in the picture we have kids as well, because the member, they bring their small kids on in the picture day that we have on an annual basis. So one of the kids stopped. They asked the question that why you have a stroller on the picture, and is the kids is part of the team as well, and that's a really interesting observation, because we are not part of the team, or family is part of the team as well, and finding that balance of providing that service to both family and the community is the key, as Mike mentioned as well.
We have an email here, and let me just pull it up here. This is an email from Julie in North Vancouver. I've never needed the assistance of North Shore Rescue, but I spend a lot of time out on the trails. I make sure that if I see anyone who's consulting their phone or a map or looks uncertain, I inquire whether they know where they are and are okay. For the most part, people are just pondering options, but I've helped enough people with navigation that I figure it's always worth checking. That's great, Julie. Thanks for sharing that. I spend a lot of time on the trails on the North Shore as well, and I have been helped by someone as I was looking at the trail signs. Someone just kind of walking by, going, "Do you know where you're going?" So that is very much appreciated. Thank you for that. I want to play a little bit from the show, Search and Rescue, North Shore Rescue now, and you don't just work with, searching and for lost hikers or campers. You were actually involved in the rescue, the evacuation during the catastrophic floods in November 2021. I'll ask you a bit about that, Mike, but here's the clip.
Oh, I see him there.
Okay, yep.
Yeah, got it.
Yeah, we'll just keep it on this side of the house.
Yep. Okay, so I have both rescuers on the hook, ready to enter the pattern.
Okay.
I have the target area in sight. Rescuers are going down. And for 300.
300.
Okay, stop, hold position there.
Holding.
Okay, they're coming up nicely there. You're good to gain elevation.
Okay, we're coming up.
You're coming in the aircraft now. Got you coming in nice.
Wow, pretty incredible to see rescuers being lowered from the helicopter down to where the flooding has occurred and people waiting there. Mike, this was, really a huge event, a devastating event from people in the Sumas Prairie. Can you tell us a bit about what your job was during that time?
Yeah, we were called along with some other of our neighboring teams to assist with evacuation of residents from their homes, people that were trapped with no way to get out. And for us, this was a really kind of outside the box experience because we trained heavily with our fixed line and winch rescue in mountainous terrain, but we haven't really trained in going to homes and taking into consideration the power lines that could be there or other hazards that were present. So this really opened up our eyes, and it was the beginning of our night vision program as well. So we were very cautious and methodical about how we went about those extractions. And the other thing that I noticed was the extreme impact that it had on the people that we were rescuing, because we were pulling them out of their homes, sometimes at night, and they were leaving everything that they had, and they would be uncertain as to whether they would ever go back to that spot, and their belongings would be there. So in some circumstances, small children, all they were able to bring was just a little stuffed animal. And that really resonated a lot with us. And we were very proud to be a part of that extraction and to assist our community.
It's been a couple of years now. When you look back at that, what are your feelings? And do you worry that given climate change that we are going to be looking at similar events in the future?
I mean, it's certainly top of mind for us. And because of that, we've increased our training tempo and basically our service delivery to be able to accommodate that in a very timely fashion. But our hope is, that we're not needed, but, we're going to make sure that we're ready if we are.
Let's take another call now. We're asking you about your experience with search and rescue, if you have been helped by a search and rescue team, if you are involved in search and rescue, wherever you are in the province. Love to hear from you. 1-800-825-5950, 604-669-3733. And Maria is joining us from Valemount. Hi, Maria.
Hello. Thanks for having me. And I have to warn you, it is a funny search and rescue story, and it happened about 20 years ago. So I'm originally from Austria, and my mom and my best friend came to visit us. And the day they were supposed to be scheduled to fly back to Europe was Mother's Day. And we decided we wanted to show them our local hot springs located in the Kambasket Lake, only open a few weeks of the year. So we decided to do that before they were heading out back to Edmonton. So in order to get there, you need to drive down 24 or so kilometers down a logging road. And in the springtime, always an avalanche comes down. So you have to wait until the avalanche is down, and then you can walk over the avalanche area, and then you will climb down a steep hill, half a kilometer down to the hot springs. Now there is a road there, but 20 years ago, that's how you got there. Everything went well. Our kids were already jumping in the self-made pool there. And my daughter took off her hairband and wanted to throw it over to my friend to catch it. And my friend twisted her leg in such a silly way and had a very complicated break. That's what happened
She
to her.
broke her leg.
Yeah.
Oh, no.
So my husband climbed up to the logging road, found a logging truck that wasn't locked.
Yeah.
You called with this was before cell phones.
Yeah.
So called
Oh, my
911
goodness.
over the car phone there.
Yeah.
Managed to get a truck driver on Highway 5, and he told them, yeah, we are located down by the hot springs where the avalanche, close to the avalanche chute.
Yeah.
And then we waited. And 2 hours later, the helicopter comes, and the weather had turned sour and ugly, and my friend started to be really cold. And my husband said to the guy, he said, you know, what took you so long? And he said, well, I have to say the guy doesn't live here anymore, and he was a bit of a hippie-ish guy. He said, you know, it's Mother's Day. I had to celebrate with my wife first.
See, there you go. There it is with the family and the rescue interacting. Maria, thank you so much for that. It is a fun story, heartwarming story. It all worked out for everybody. Let me just read one last email here, and I'll just ask for a final word from my guests here. Chris writes, I once broke my leg trail running in Squamish, and I was too embarrassed to call search and rescue. I managed to make it down 40 minutes with a makeshift crutch, but suddenly realized how vulnerable I am on longer hikes. These guys do a fantastic job. I know people get embarrassed sometimes about needing the help, but Behzad, perhaps I'll ask you, I just have about 30 seconds here, but can you just give us some advice for people? What should they keep in mind as they head out?
Absolutely. The thing about the North Shore or a mountain close by is that they can get complex really quickly. We had a case of hypothermia in end of August down in up in Mount Seymour. So what I really recommend your listeners, audience to do is to just take that additional 2 to 3 minutes to go through their packs, to go through the actual map of the trail that they want to do, even if they expect it to be really quick hike. It's worth to have that additional, water or, one more, protein bar. Maybe you can help somebody else out.
There you go. Behzad and Mike, thanks so much for your time.